For today's learning objectives, first is we will describe how the movement of the diaphragm helps the air go in and out of the lungs. So we will focus more on the diaphragm. Second is to explain some common respiratory diseases and its causes. But first, let's have a recap on the different parts of your respiratory system. So first, let's start with the nose, okay? And then the nasal passages, pharynx and larynx, trachea, the lungs, bronchi or bronchus, you have the locus, and then the bronchioles, the alveoli, and of course the diaphragm. So from our previous discussion, as I've said, we will focus more on the diaphragm. So today, let's discover the function of diaphragm. Previously, you have already learned about the essential parts of the breathing system and their function. Now, you will understand the mechanism and activities of the lungs and the diaphragm. Now, I want you to observe this GIF or this animation. So, what have you noticed? Okay, when we inhale, our stomach increases its size, right? It is because the lungs expands as the air enters the alveoli. So when the lungs expands, so as the rib cages to give way to the air. Then when we exhale, they all return to their original size. Diaphragm is a powerful muscle nested at the bottom of the ribs. Okay, so diaphragm is a dome-shaped muscle that lies beneath the lungs. Okay, is located below your lungs. It contracts. When we say contract, it moves down during inhalation as we take in oxygen, and it relaxes during exhalation. Now, this is how your diaphragm works. Okay, when you inhale air, happens, it contracts. And as the air goes out, what will happen? It creates a dome shape. Okay? To understand how the diaphragm works, let us first realize the process of inhalation and exhalation. When we inhale, oxygen gets into the lungs, specifically the alveoli. We have mentioned that these air sacs inflates like balloons whenever they are filled with oxygen. That means it requires greater amount of space to accommodate the air inside. So, as we inhale, okay, the diaphragm muscle contract. Again, when we say contract, it moves down. The diaphragm moves down and the chest expands. Okay? Kaya pag nag-inhale tayo, lumalaki yung chest natin, di ba? And also, the rib cages also expands. Remember, these rib cages are the ones that covers the lungs. Sila yung mga gitara dyan na nagko-cover sa ating lungs. So, since there is now more space inside the lungs, okay, dahil nag-inhale tayo, lumaki yung space inside the lungs, that means there is less pressure inside the lungs. Okay? Kasi po, pag malaki ang space sa loob, less yung pressure na may experience ng lungs. Okay? Remember that. How about exhalation? So it is the process of releasing carbon dioxide from the lungs. Okay, just like balloons, when you release air inside, it deflates, right? Pag nawawalan siya ng hangin, di ba, umiinipis siya. Now, as we exhale, what happens to the lungs and the diaphragm? The diaphragm muscle relaxes. Paano ba yung relax mode ng diaphragm? So, para siyang naka-dome shape. Yan. Pag nakaganyan yung diaphragm mo, naka-relax yan. Okay? Kapag nakaganito naman, naka-flat, ano naman yan? Naka-contract. Diba? Okay. So, the diaphragm and the ribs return to their original place. The chest cavity also return to its original size. And there is now less space. O, kapag ganito na. Yan. Less space na yun, diba? Since lumiit yung lungs natin, it means dahil lumiit siya, nagkaroon ng less space sa loob at nagkaroon ng greater pressure. Okay? Mas greater yung pressure kapag maliit ang area. Okay? Remember that. Okay, so these are some common diseases that affects the respiratory system. First is common cold. So, common cold is an upper respiratory tract infection. Again, when we go back to our first discussion, when we say upper respiratory tract, it includes the nose, nasal passages, and larynx and pharynx. So, this infection caused by many different viruses. The common cold is transmitted by infected airborne droplets or by direct contact with infected secretions. Halimbawa, yung mga laway, yan. So, common cold, ito po sa ating layman's term is also called ubo at sipon, or ito yung tinatawag natin na trangkaso. Okay? So, ano bang gamot ng common cold? Common cold does not have cure, but its symptoms can be relieved by taking enough rest and drinking lots of fluids. Okay? So, this disease usually runs its course for about a week or so. Okay? And, ibig sabihin nun, kusa lang siyang nawawala. Influenza, or also known as flu. Okay? It is a contagious illness caused by several influenza viruses, which can lead to pneumonia. It can spread globally in seasonal epidemics. Okay, when you say contagious, the word contagious means it spreads easily from one person or organism to another by direct or indirect contact, and its complications can be deadly. So, nakamamatay po ang influenza. Ang influenza ba at COVID-19 ay pareho? Kasi pareho silang virus ang cause? Hindi. Okay, so let's talk about the flu and the difference and similarities of flu and COVID-19. Okay? So, ano ba yung mga similarities nila? Pareho sila ng symptoms. Okay? May fever, lagnat, cough, may pag-uubo, shortness of breath. Okay? So, parehong flu and COVID-19 both experience those symptoms. Ano naman yung pagkakaiba sa sintomas? Loss or change of taste and smell. Itong loss and the change of taste and smell ay nasa COVID to. Na-experience to ng mga COVID patients. Diba? Kung marinig nyo sa balita, ito yung parang, nawawalan siya ng panlasa, nagbabago yung kanyang pang-amoy. Okay? So, ito ay kay COVID. Another is, okay, nasabi na natin, cause nila ay both virus. Pero sa COVID, specifically, ang tawag sa kanya ay SARS-CoV-2. Diba? Yun yung pangalan ng virus. Another is, ano pang difference nila? Symptoms may show after 2 days or as late as 14 days after infection. Ito kay COVID to. No? After 2 days or as late as 14 days bago pa lang lumalabas yung mga sintomas ng COVID. Kapag flu, kapag after 2 days, meron na yan. Diba? So, develop symptoms 1 to 4 days. Ito pala, 1 to 4 days. Meron ka na agad sintomas. COVID-19 is more contagious. Mas nakakahawa siya among certain population and age group than flu. So may nabasa ako, ang sabi doon, kapag flu daw, mas affected yung mga bata. Kapag COVID naman, mas affected naman yung mga matatanda. Specifically, meron na silang mga underlying health issues. Halimbawa, yung mga sakit sa puso. So, sila yung mga madaling tamaan ng COVID. Another is, sa similarities nila, while COVID-19 and flu viruses are thought to spread in similar ways. Okay? Pareho silang nakakahawa, pero sabi nga natin, mas nakakahawa si COVID. Next one is asthma. Characterized by difficulty in breathing because the airway constricts, causing cough, wheezing, and shortness of breath. So, bakit nga ba tayo nagkakaroon ng asthma? Una, ang asthma ay meron sa mga taong very sensitive ang kanilang air passages or airway, yung daanan ng hangin, no? It constrict, ibig sabihin po nun, naninikip siya ng pusa. At syempre, dahil naninikip siya, ubuhin, and nagkakaroon yung tinatawag na wheezing of sound, no? Parang hirap sa paghinga, and shortness of breath. It is usually caused by air pollutants such as smoke, pollens, and dust, okay, that can triggers asthma. Usually, yun nga, nasabi ko na, sensitive yung kanilang airway at ito ay hereditary o namamana. Okay, namamana po ang asthma. May gamot ba ang asthma? Sad to say, wala pong gamot ang asthma. Forever mo na siyang magiging sakit. But we can pacify the symptoms of asthma. So, some of the asthma patients use nebulizer or kapag malala talaga, kailangan na ng oxygen. Okay, so notice this picture. This one is the normal airway. Walang nakaharang, right? Pero kapag meron kang asthma, asthmatic ka, look at the airway. Merong nakaharang na mga mucus, no? Yan po ay mga phlegm. Okay? Na nagkakaroon ng ganyan dahil sa mga tinatawag natin na pollutants, no? And yung mga pollutions na kine-create ng pathway dahil sila ay sensitive. Okay? Bronchitis. Inflammation in any part of the bronchi and bronchial tubes and often secretion of sputum or mucus. Okay? When we say bronchitis, okay, pag may ganito sa dulo, ibig sabihin po nun, inflammation. Ay, ano bang Tagalog ng inflammation? Pamamaga. Okay? Ibig sabihin po nun, nagkakaroon ng inflammation saan? Sa bronchi or sa bronchioles. Okay? Nagkakaroon ng pamamaga. Okay, so dahil namamaga yung bronchi ng taong may bronchitis, okay, nagke-create ito ng mucus. Okay? Ano nga uling mucus? Parang phlegma, no? Okay, that blocks the airways. So, syempre, dahil may nakaharang sa airways niya, mahirap mag-inhale. Okay, usually, ang ginagamot natin dyan ay antibiotic. Syempre, depende yun sa iyong doktor, diba? So, kailangan alam ng doktor. Look at this picture. This one is a normal bronchi, bronchioles, and this is the bronchial passageway of a person with bronchitis. Pneumonia. Any infection in the lungs characterized by building up of fluids in the lungs. This is caused by infection from bacteria or virus. Okay? So, its symptoms includes fever, okay, Okay, nilalagnat, chest pain, fluid in the lungs, and difficulty in breathing. So, since pneumonia can resemble the common cold, kasi parang pareho sila ng sintomas no? Okay? It can be easily overlooked. So, parang, ano lang yan, common cold lang yan, magpahinga ka lang. Pero pneumonia na pala, di ba? So, kapag ganon, dapat nagpapacheck tayo sa ating doktor para nakikita niya yung mga iba pang sintomas that may lead to correct diagnosis. Okay? So, anong characteristic ng pneumonia na iba sa common cold? Okay? If you further note or if you further inspect the lungs, no? There is a fluid. May tubig sa baga. Yan yung isang term, no, na ginagamit natin if we describe pneumonia. Okay? So, anong part ng lungs yung nagkakaroon ng tubig? Usually, it is your alveoli, no? It will be filled with water at pag nagkaroon ng tubig yung alveoli mo, magkakaroon na ng bacteria sa loob. Okay? At yung bacteria na yan or mga viruses na yan, kusa silang dadami. That will cause much more greater damage in your lungs. Next is tuberculosis or TB. Is caused by Mycobacterium tuberculosis, which can spread via droplets through coughing, sneezing, spitting of phlegm. Okay, symptoms are coughing, masakit kapag umuubo, yung dibdib, no? Chest pain, shortness of breath, loss of appetite, kaya nangangayayat, fever, chills, giniginaw, and fatigue, laging pagod. No? So, yan yung mga symptoms. Okay, so, tuberculosis is highly contagious. Opo, nakakahawa siya. Kaya pag may mga patient tayo na may tuberculosis tapos kasama natin sa bahay, dapat lahat ng gamit niya mula plato, tuwalya, kutsara, baso, lahat ng personal niyang gamit ay nakahiwalay. Okay? Kasi nga nakakahawa siya. Now, this is the Mycobacterium tuberculosis look like. It is a rod-shaped bacteria, okay, that lives in the lungs. And this is how the X-ray of a person with tuberculosis looks like. Para siyang parang kinain yung lungs niya, puti na namumuti na yung lungs niya. Okay, so nakakatakot magkaroon ng TB? Yes, noon. Pero ngayon, meron na tayong solusyon dyan. Okay? DOH launched this, what we call TB DOTS. TB DOTS means Directly Observed Treatment Short Course. 6 months na gamutan para sa taong may TB. Dati nakamamatay ang TB, pero ngayon meron na tayong lunas dyan. And libre ito na binibigay ng DOH. It is given to a tuberculosis patient, and it is recommended by the World Health Organization. It is where yung taong may sakit na TB ay pupunta sa mga health center at yung healthcare worker within that certain barangay, siya yung nagbibigay ng gamot. So that, namomonitor niya, kaya tinawag siyang directly observed. Kasi sila mismo yung magbibigay ng gamot. And short course, kasi po, within 6 months lang. Okay? Paano man pag hindi kinaya ng 6 months, may TB ka pa rin? Another 6 months ulit. Hanggang mawala yung bacteria sa loob ng katawan. Last one is emphysema. In this disease, many alveoli is destroyed as they merge and the alveolar walls lose its elasticity. The part of the lungs that is being affected when a person has an emphysema is the alveoli or the alveolus. What happens is, I take a look at this picture. This one, ito yung may emphysema, ito yung alveoli niya or alveolus. And ito naman yung sa normal. Okay, anong pagkakaiba nila? Notice that here, when a person has an emphysema, nagkakaroon ng merging of pagdidikit-dikit, pagsasama-sama ng kanyang mga alveoli. Okay? Tingnan nyo naman dito sa normal, diba? Kitang-kita nyo yung may pagitan. Okay? Yung kanyang mga alveoli o alveolus. The major cause of emphysema ay cigarette smoking, no? Kaya po yan kulay black kasi meron tayong tinatawag na tar, T-A-R. Okay, yan po yung parang latak ng sigarilyo na dumidikit sa ating mga alveoli. And siya yung unti-unting sumisira sa alveolar walls, kaya nagkakaroon ng merging na tinatawag. And when a person has an emphysema, mahihirapan siyang huminga, no? Parang hinahabol niya lagi yung hininga niya kasi nga mahirap mag-inflate yung ganitong klase ng alveoli kasi masyadong malaki, unlike yung mga maliliit na regular alveoli. Okay, so this is the effect of emphysema from a healthy lungs to a person with emphysema. Notice that when your lungs is still healthy, or your alveoli is still healthy, yan yung itsura niya. Now, nanigarilyo. Nag-start ka manigarilyo. Okay? Bata ka pa lang, naninigarilyo ka na. Ito na siya. Yung tar o yung latak ay naiiwan dyan sa iyong alveoli. And hindi yan nawawala dyan. Kasi padagdag lang siya ng padagdag. As time goes on, ayaw mong tumigil. Okay? Pagdating ng matanda ka na, ano siya ngayon? Nabura na ang iyong alveoli. May emphysema na. So, wag mo nang hintayin. Diba? Yosi pa more. Okay, so, ito po yung isa lang sa epekto ng cigarette smoking.